Let's clear up health. Studies show that conversion therapy leads to suicide attempts in trans youth. Prior research has been unable to tease out cause and effect between health outcomes and gender-affirming care like hormone therapy or gender-denying interventions like conversion therapy, largely because of lack of broad data or inappropriate control group. The Conversation team, along with other researchers, studied data from the 2015 U.S. Transgender Survey, which includes responses from over 27,000 trans adults across the nation. They compared people who initiated an intervention with those who initiated the same intervention 1 year later. They found that over 40% of young adults living in family environments that are unsupportive of their gender identity attempted suicide by the age of 18. The analysis also showed that hormone replacement therapy significantly improves the mental health of trans youths in comparing differences in suicide attempts between trans youths who started HRT a year apart from each other. They both found that both groups experienced similar increases in suicide attempts over the 5 years before initiating treatment, but experienced a significant drop the year they started treatment. Overall, initiating hormone therapy led to 14.4% reduction in attempting suicide for trans youth. There was a 13.8% increase in attempted suicide within the first year of conversion therapy and a 47.5% increase in running away from home. Well, I want to say I have a lot to say about this being transgender. You know, every day at Trans Inclusive Group, I receive emails from the Crisis Fund with parents and trans youth asking for resources and things of that nature, trying to see, you know, what resources they can get to help their children. And I find it so beautiful when parents reach out and they're gung-ho into helping their trans kids. I used to work at a facility in Wilton Manors that provided hormone therapy. Now, we didn't provide it to youth, but as young as 18. And I remember how those young adults would come in with their parents, and their parents were so supportive and they had their head held high. And it just, I remember so many of them telling me about their experiences and how it felt to have their parents support them. And those people who parents supported them, like 4 and 5 years later, I know of 10 of the trans patients that I just had who are out and they're in college, and one of them is getting ready to be a doctor, and they're just positive individuals. They're thriving. Whereas I definitely can tell you stories of people who have attempted suicide because their parents were not supportive and were not able to start their hormone therapy. You know, I can use myself for an example. I mean, I started hormone therapy at 18 years old. Now, my parents weren't all that supportive then. They eventually came in line, but you know, hey.
But it's scary for those who don't have that support, and I would suspect that there's a larger group of people that don't get that support, especially when you get outside of a bigger city, and you get into middle America where the lack of education, lack of life experience, and this kid doesn't know where the resources are to go to. And we look at our state right now, you know, with our current governor, and what that means to trans kids that are trying to find their way, that are being told that they're bad or evil or wrong because they're different. And there's no place for them in our state. And I know of 2 gay couples that have moved out of the state because they have what they believe to be is going to be trans kids. And one of them, their daughter's only like 7 years old. They don't want her to be in this environment, because if she does decide, you know, and they're letting her have her freedom, but she went to camp last year and just went by the name of Joe, you know, and so nobody in camp knew she cut her hair short, and they're letting her do her thing, but they don't feel it was safe to stay here, and they're currently living in Texas, or to live in Texas, and they moved to California because they don't want her to have that bad experience.
Yeah.
And lack of resources. We don't have the resources here either anymore.
It's not just that, but the statistics don't lie. they're showing the absolute truth, and I know this from a personal experience. If I didn't start HRT when I did, I'm not sure that I would be alive today. So the lawmakers have to stop picking and choosing what statistics they want to show and what statistics that they want to utilize when presenting these to the higher ups, because that's what they want, but it's not the truth.
And Evan, I'd be curious, because it had to have scared you when our governor said, we're going to stop treatment. Like, it was that threat to stop it.
It did.
Well, you had already started. And what does that do to your body? What does that do to your mental health?
I went literally, I was almost crying. I literally was like so angry. I went to my mom, I was like, we're moving. And she was understanding. She was like, if that does end up happening, we are moving. Because like, I'm fortunate enough to have parents.
That's amazing.
I am fortunate enough to have parents that like do support me and that will pick up and move just to keep me on hormone treatment, because they do understand the science and they do understand the research and how valuable
it must be
is.
incredibly stressful to think about your life on a countdown clock. You've got 24 months approximately. You got to run the clock out to get to 18 and become an adult, to principally be exempted from what is trying to be done. I'm curious in terms of this story. First off, you talked about statistics. I got lost in your statement, because were you talking about COVID-19 pandemic? Were you talking about masks? What bad science were we talking about that they're not going to? I'm making a joke about they do the same thing on everything that has to do with science. I'm curious from your standpoint, how do you get through 16 years old on HRT? How do you get through, and your friends that are in similar situations, how do you get through a week with concentrating on just living the life that all 16-year-old kids, please forgive me, I'm wording, should be doing, that you shouldn't be worrying about existence? How do you get through?
I guess it's just focusing on the little wins that we do have, on all the moments that we do get to celebrate, you know? Like, I got my first job. I was able to start driving. I have more facial hair than I did 6 months ago. Those are the little wins that we can celebrate until we end up maybe one day not being able to keep doing these hormones and that are life-saving.
Yeah. And Evan, I'm also curious in terms of the reporting here. First off, I slap out at the idea 27,000 people participate in this study. It is a gigantic study for the trans community, and their conclusion that first 40% have tried to commit suicide, and there was a 15% reduction just being able to participate in hormone replacement therapy. For you, when you hear those statistics, are you shocked by the 40% suicide attempt?
Not at all.
Yeah. Without being too personal, is that something that your life has thought about through this process?
I can say that it did bring me a lot of anxiety. I was having a lot of panic attacks. And when you're in that sort of like downward spiral, it is easy to get sucked into it. So it's important to get into services that can provide you with the correct, the correct support, and do whatever you can to support those people, because they're in a critical state. And not just that, but by showing your support to that one person, you're also showing your support to everyone else.
I find it interesting too, because between you, Adriana, and you, Evan, your parents played a role in it. Like, I don't know whether your parents would have moved out of the state, or they would have just said, suck it up, you know, and you'll get to it when you turn 18. And you, on the other hand, have a parents that say, this is important enough that we're going to move if we need to. And to give you, that's a very special set of parents that are willing to uproot, find new jobs, find new friends, buy a new home, sell, and give everything up because they honor and respect you enough that this is so important, because they know what the long term is. They know that there could be a negative impact, you know, when it comes to suicide or whatever it might be. But, you know, both of you coming from, it's interesting, both of you coming from a different type of family, your perspectives of how you got through it to that point. Because you had to survive to 18 to be able to do what you really wanted to do, and that could not have been easy. And, you know, in your case, your parents are willing to say, don't hold out to 18. We're going to make this happen now.
Well, I think I come from a different time. I'm 48 years old. So when I started to transition, it was, I guess, 1995 when I first thought about it. So it definitely wasn't how it is now. It wasn't as open. I hadn't even seen a transgendered person or knew a transgendered person at that age. I didn't know I had those options.
We didn't have Google, girl.
We didn't have Google. We didn't have Google. But eventually when I, researched the information, other people let me know that I could go to the doctor. I had to do all that by myself.
Yeah.
I found that.
One final thought, Maria, we've got to move on to Amy, but this is a unique opportunity. I appreciate both of you sharing your stories and sharing your opinion and observation, and really all of us at the table. But the issue is it gives us a unique opportunity to make a couple of connections to the story. This is a very important study survey on the number of trans people that were studied exhaustively over comparison year over years, and the effect that conversion therapy has on them, and the access of hormone replacement therapy to them, and how it affects suicidal thoughts. Then we have the opportunity to talk about, from a service provider, what you do at Trans Inclusive Group so brilliantly, and from your experience as a 16-year-old junior getting ready to start your junior year in high school. For the LGBTQ community, really one of the difficulties, perhaps, I'm not putting words in either Amy or Glenn's mouth, but in my mouth, probably they would have some similar observation. It's hard for the LGBTQ community to quantify impact on the trans community. Mm-hmm. And we have to keep this in front of our LGBTQ community. This is tangible consequence. This is tangible consequence. We are not academically fighting over just rights. We are fighting for people's lives. We are Queer News Tonight, the world's first and only live daily LGBTQ+ evening news show, brought to you from Happening Out Television Network. We operate in the same model of PBS and NPR, but for the LGBTQ+ community. We educate, inform, and entertain by supporting the 10 pillars of our LGBTQ+ community, with more than 100,000 a week watching us on Roku, Apple Television, and other channels. To keep the story going, we accept donations with 100% transparency. Stay updated and live authentically with Queer News Tonight.